Thank you, Mr. Chairman.
Like my colleagues, I thank you for holding this hearing. I wish, I suppose, that it had been held before the Republican majority voted to end Medicare and before introducing legislation to privatize Social Security. As Mr. Richmond has pointed out, about a third of all Americans have no income other than Social Security, and about two-thirds rely on Social Security for most of their retirement income. We have a responsibility to see that people can enter their non-wage earning years with dignity. Privatizing Medicare and Social Security will return us to a you're-on-your-own society where it used to be old meant to be poor. To be old was to have inferior health care. According to the Ryan Plan, which has now been approved twice by the Republican majority, the privatization of Medicare, future retirees, would have real effects. They claim that those under 55 are not affected, but as Mr. Andrews has pointed out, and as the witnesses, I think, have been forced to agree, it requires that a 54-year-old would have to set aside about $182,000 to be prepared for the additional out-of-pocket costs, or a 20-year-old, today's 20-year-old, would have to set aside about $750,000 of extra retirement savings to cover the additional out-of-pocket costs. So this is on top of the problem that we all face of Americans are underprepared and are surprised to learn that they are underprepared. The average American family already $250,000 short from what they think they will need for retirement. And most are not only unprepared for retirement, they are startled to learn how unprepared they are. So rather than privatizing Medicare and Social Security, we should actually be helping workers save for retirement. My colleague Tom Petri and I have introduced the Lifetime Income Disclosure Act to inform workers of the projected monthly income they could expect at retirement where they find themselves now in the situation with what they've set aside so far. And it would provide participants with illustrative conversion directly on their annual statements, such as we members of Congress have now started receiving with our thrift savings plan. I, like most members of Congress, I think, like most members of Congress, don't have a dedicated personal financial advisor whose time is dedicated to me, and I know that's true for most Americans. So this, on the thrift savings plan, has actually been helpful. Congress and the administration must continue to do all they can to make sure that people have access to investment advice. From my own experience, I've seen the benefit of sound professional investment advice, and I'm going to continue to encourage the administration and my colleagues here in Congress to ensure that we don't take actions that could have the unintended effect of limiting the financial advice and leaving Americans even less prepared for their retirement years. Getting back to Medicare, I mean, really no one disputes that Medicare works very efficiently. So now the opponents have taken to saying, well, but it's unsustainable. Mr. Richmond, I'd like to point out what I think should be clear to everyone, that no health insurance plan is sustainable if we have 10% a year inflation above the overall cost of living. The problem is not with Medicare. The problem is with increasing health care costs. Mr. Richmond, is it not true that Medicare, according to economic studies, is more effective than private insurers in keeping down the costs?
Well, the administrative cost of Medicare is extremely low. Social Security, the administrative cost is 0.9%, and all of that is paid for out of the payroll tax. So these are very efficient programs. But on the larger point that you made, I couldn't agree more. Singling out Medicare without addressing the overall cost of health care will only lead to a system of health care for seniors where seniors pay more and get less. You're absolutely right about that, Congressman Holt. The only way to address effectively Medicare costs is to address overall health care costs in our country.
So private insurance plans would be just as unsustainable
Absolutely.
if this were to continue. Thank you, Mr. Chairman.
Okay, thank you. Ms. Roby.